I'm so excited to be here.
We're
I'm
usually on the phone or you're always doing 13,000 things at once. So sometimes you can't have your video on. And so it's just nice to actually like see you and get to talk to you.
I know. And I'm hoping bandwidth holds up here at the ranch. You know how that goes.
So I explained that you're an educational psychologist and a public health consultant with a specialty in traumatic brain injury. So you wanted to kind of take it from there because I know that's already just kind of like, wow, like this woman pretty much knows everything about TBI. So
I don't barely scratch the surface, but thank you for the compliment. Yeah, you know, we've had a lot of experiences professionally, personally. Everybody's kind of got the info, you know, and I'm not one to toot my own horn. I'm just another person on the planet who really wants to make a difference in communities. And that's pretty much what I do. I'm grateful to be able to help families. I'm grateful to be able to work with organizations that support individuals with disabilities. And to me, it's a blessing, is all I can say. It's just a blessing. And then, you know, over the years, all the referrals and getting to know you guys at the clinic, it's really been a journey. And all I can say is I'm not certain that people really understand the extent to which, especially concussion and mild traumatic brain injury, are out there in the community, and that so many of the people they're dealing with have undiagnosed head injuries. I wanted to spend some time today, and I hope you don't mind if I just put up a slide or two.
Yes, please.
Okay, let me see if I can share my screen, and then I'll click on a couple of these materials, because I like to start with epidemiology. That's kind of my shtick. It's where I started. Let me see if we can get this graphic up. There we go. You're going to kind of see me in real time here, which is totally cool.
I love it.
But I would really like to share just some comments, because the most comprehensive report that's come out, and where we were expecting another one in 2020, it just isn't here yet, really talks about how TBI is an epidemic. Now we're all in COVID, and we like all get COVID, right? But I'm not always sure people really understand the depth and breadth of what we're dealing with when we start talking traumatic brain injury. Right. First of all, this slide does not include anything related to other acquired brain injuries, encephalitis, all the neuro issues we're seeing now with COVID-19, you know, suffocations, cancer tumors. None of the other acquired injuries are represented here. Now, when you start talking 2.7 million people showing up in ERs and hospitals across the United States every year, and a third of those are young people under the age of 14, we've got a big problem on our hands.
Yeah.
And these statistics are just the tip of the iceberg, and I don't think that's what people realize. For one, when the CDC reports, as you know, we're only talking about community-based hospitals. We're not talking about any federal programs. So we're not talking about federal prisons, anyone seen in a federal institution, Indian Health Services serving all of our Native American communities and our 638 centers in Alaska. We're not talking about the VA. We're not talking about the Department of Defense. When you talk about these 2.7 million people every year, injuries significant enough to be seen in an ER or to be admitted to a hospital, that's all that's being captured in that 2.7 million. So from your perspective, who else isn't in here?
I mean, I was hospitalized for one of mine because I had literally a hole in my head and blood was gushing out. And I couldn't see it. I had no idea what's going on. I didn't have health insurance at the time. I feel so bad. My friends text because I'm like, oh, it's like a joke. I don't have health insurance. I'm not going to the hospital. They sent my dad a picture of me with a hole in my head, gushing blood. And we're like, should we take her to the ER? And they were like, yeah. And they just stapled me up, told me have a great day. And I couldn't be anywhere except a dark, quiet room for an entire week. It was my vacation before I was actually moving to Atlanta. So I was trying to just enjoy my time with my friends and family because I knew I wasn't going to be going back to Maine anytime soon. But I mean, that was my 5th concussion, which is why it was so severe. But that was the only one I was hospitalized for. You know, the one that I had with sports, just a little bit light stitches. Thankfully, my mom is wanted to make sure that my pretty face stayed pretty. So she got like a plastic surgeon in the ER to actually do my stitches on my face. But yeah, I mean, I had 6 or 7 and only one was hospitalized. They didn't do any testing. Like I said, they just stapled me up. I went back a week later. They just yanked the staple out just like you do when you're, it's like ridiculous. And, you know, if they had done a web neurocognitive test or even just a simple depression inventory, like something to get some type of data so that we can remeasure it later. Thankfully, they were doing that with football players in high school. But as you and I know, like no one should be playing football in high school anyway. So it's like kind of like a default thing, you know, like why are we making the cars go faster when we could just lower the way that they go instead of just like improving safety measures, you know?
Exactly. So your first 4 concussions are technically not even represented by the red bar,
Correct.
right? And then you talk about all the people who go to urgent care. They never step foot in a hospital. Or
Right.
maybe they're just seen by their primary or an internal medicine guy. Or
Mhm.
maybe, you know, a victim of domestic violence goes to her hairdresser because she just got her hair pulled out. She's wearing dark glasses and has raccoon eyes and never ever sees anybody. So
That
the
happens a
problem's
lot.
huge.
Yeah.
And I think people need to be taking a much deeper, closer look at who they're serving, especially when the behaviors that people are seeing are creating social isolation. They're creating incarceration. They're creating disenfranchisement from their families, their workplace, when the behaviors are not allowing people to be who they want to be intentionally, or they're somehow marginalizing them from the individuals they want to be around. All of us as professionals have got to start asking questions because we're wired to be social. And
Yes.
when we're seeing people who are not social or whose social behaviors are creating conflicts in families, difficulty with employers, right? We got to start asking deeper, bigger questions. There's lots of people out there with neuro impairment and they need to be identified and they need help. So my sense is, and part of the message we continue to carry is, one, a primary prevention message. You know, and I think that's true for you when we talk about helmets. Everybody knows helmets don't stop concussions. They may reduce severity a bit, but they don't stop them. The brain still had a jarring episode. The brain's still changing in terms of its electrical and chemical nature, even if we never see it on a
Right.
CT or an MRI. Or maybe people are lucky enough to get to the clinic and they're lucky enough to be evaluated. And maybe they get some insights from that. But we got a lot of people out there who don't even understand why the struggle is real and it's difficult. You have no idea how many young people, adolescents, children, elementary, junior high school students, when we finally explain to them that they're not stupid, that they're not difficult children, that they have a neuro impairment that can have an intervention, one or more. They can get accommodations. They're not the weird kid on the special bus.
Right.
You know, I think those messages are so important, and so many of us are serving clients and not understanding we've got to look deeper. We've got to start systematically, universally screening to ask about brain injury. And people are like, well, how do you do that? I only have 50 minutes with my client. I've got paperwork and logging. I really want to do the best job I can do. But now you're asking me to do one more thing. And we hear that a lot, right? We hear it from voc rehab counselors. We hear it from private professionals. You know, it's not difficult to ask some screening questions on your intake form. You know, that to me is the first place it starts, because then it becomes universal and it's on everybody's intake form. So whether you're a school district who's getting ready to look at an evaluation for a student who's come under question, maybe it's about autism. It can be an unrelated disability. I don't care. Why aren't we asking everybody? You know, and it's something simple like the helps. And I'll pull it up because maybe some people on here have never seen it before. but it's a really simple questionnaire. We're not talking rocket science here. We're talking, let's take that acronym and ask some simple questions about hit on the head. Have you been to the emergency room? Have you ever lost consciousness? Losing consciousness is a severe, mild traumatic brain injury. We're not talking mild here.
Yeah, Phineas Gage had a rod go through his head and still was conscious when parts of his brain went out of his body. So when people are like, oh, I didn't lose consciousness, I'm like, that has nothing to do with it.
It has nothing to do with it. By the time people are having altered states of consciousness, even from that subconcussive blow, the one that doesn't even rise to the level of consciousness, we still have to be concerned that we're changing electrical and chemical function. And that can impact behavior and performance, right?
Yeah.
And then we talk about all those other things that happen, problems that are impacting our daily living. I mean, as survivors, you and I know life changes. And most of us can tell you that magical day when we went from A to B. I know parents can, and they talk about having two different children. I know adults do, because they talk about who they were before and who they were after. I have a very clear distinction of being two very, very different people in terms of function, in terms of capacity, in terms of performance, in terms of activities of daily living. We joke. I say, who needs closets? I got my laundry bin and I got my laundry bin. And stuff just doesn't get to the closet anymore. But you know what? I'm saving a lot of time not fishing through a closet trying to figure out what to wear. And I say that jokingly, and then there's a part of me, and this, there's a part of me inside that loved that really organized closet, that went and looked and said, oh, the clothes go from faded colors to dark, and it goes from short sleeves to long sleeves, and there was some pride in that organization. So I grapple with that gap. And I think,
I can help you with that.
I know that. I know that.
It's like my favorite thing to do.
Right? So I believe that we take those things personally and we go, gosh, I'm not the same person I was. I'm not okay. And the reality is we're adjusting every day. We're making accommodations every day. Am I any less of a person? No. Am I more empathetic to the survivor? Absolutely. And I believe that God blessed me with that difficulty as a way to be able to connect at a level that I didn't understand when I was just the professor in psychology, or I was just the public health consultant, or I was the curriculum specialist. I couldn't relate, even though I was a parent of a young person with a traumatic brain injury at a very young age. And I fought systems like heck to get my kids services. It was still not a survivor's perspective. And today I have that. And today I'm blessed with that. Does it create difficulties? Absolutely. Am I going to deny them? No. Am I going to work around and create accommodations and learn more and read more and try to understand more and meet with others? Absolutely. So, I share these tools because I think these tools are important, and it tells you to screen and evaluate it, and they're free. The World Health Organization is using it internationally. Can we at least start with 5 simple questions for screening? And what that does is it opens up a whole different trajectory for the conversation, right? It then becomes, you're not a bad person, you're not doing bad things. It becomes, you have a neurological impairment, and how can we help you? Not only what happened to you, and we've got a lot of people talking about ACEs and trauma-informed lenses of work. And I'm not in any way downplaying that, because I believe and I know that we do have changes to hippocampal performance. We do have changes to hippocampal structures, especially when you have a lot of toxic experiences early. Right. But what I'm suggesting is that if we really take an intention of beginning to screen each and every individual that we're working with in a way that even just begins to open the door with the slightest amount of light coming through, we have an opportunity to then have a different dialogue.
Yeah. What if they answered yes to several of these questions? And again, as a doctor that's extremely busy, instead of having to find a referral for a talk therapist, finding a referral for a physical therapist, finding a referral for an educational psychologist, finding all these other referrals, if you can just go to one place, a concussion specialist physician that can evaluate all of these with SPECT image and or blood work.
Absolutely.
It's going to save you time. It's going to continuously add to compassion of the universal human experience. I have no idea when I saw it or who wrote it, but there was this beautiful article from a physician saying why I was late for your appointment. And it was about asking certain questions like this, or ACEs. When she started implementing it into her practice, it was opening these big boxes of worms. But for her, it was so validating that she really understood why her patient was having chest pain, why their cholesterol was always out. And it was because of a lot of environmental structures that were hindering their health. So that's why she was 15 minutes late for her next patient who might have been kind of annoyed. But if we start asking all of these questions earlier and we ask them every yearly, it's going to save us all heartache and time, and it's going to give us efficiency. I mean, that's our goal, right? Is efficiency while giving the best level of patient care. If we can ask these questions early and keep asking them, like we do at Amon Clinics, we ask you about head injuries multiple times, because when you see it on your scan and you swear nothing happened to you, we just needed to have the information. Because when you see a traumatized brain, you're like, that can't be mine, nothing's happened to me. But the crappy babysitter that was texting your boyfriend when she was supposed to be watching you as a baby and you fell off the couch and she never told your parents about it because she didn't want to get fired or sued. Like, those are the kind of things people need to think about. And I know this is creating anxiety for some people, but what if that anxiety is because of a traumatic brain injury? Like, it's just a conversation that you and I know, like you say it even more than I do. Like, we need to be having this all the time. We need to be talking about this all the time.
All the time. All the time. And we need to be getting this information in the hands. I don't care if it's little league coaches. I don't care if it's softball. I don't care if it's your hockey team, if it's sports, if it's rodeo. I don't care what it is. If it's sports related, we need to be doing it at every intake, every year. It needs to be part of re-entry to school, right? You come back to school, everybody fills out the new packet every year. Why aren't these questions there? Because if nothing else, and we flag 5, 10, 30, 60 students, and all of a sudden we said, you know, we're going to have a conversation with our health professional here, be that a health aide, be that a school nurse, somebody, I don't care if it's the PE coach who's teaching health classes. To me, it doesn't matter. It's somebody who recognizes that this is a problem and it may be undermining people's quality of life. Let's do it. Right? Let's do it. It
takes one person. I mean, I hope that you would agree and you've had like 1 or 2 teachers that really stood up for you and took care of you, because I had several, which now I realize they knew that I was doing a good job and trying hard, but like each year when certain things were getting more difficult, like I needed more support. Right. Like, why would I suddenly be in all honors classes and then I'm actually in AP English, but still in remedial math, repeating math? Like, there's something wrong when I was doing well in all subjects until a certain year, which was the year after my first major concussion. So just asking the questions. You don't have to know the answers. We have the answers. We can give them to you. Our doctors can give them to you. Psychologists understand TBI can give them to you. We just know what's going on.
Exactly. And we've been trained and we can offer opportunities. And you know me, I love giving free stuff out. I think free is really cool, right? And
you really do.
I know I'm really bad about it. I should like not do that, but it's okay. I love free stuff. So it's a personal characteristic. What
I know, you're so wonderful, so generous. It's hard to put in words.
One, and so then here's the next part. Let's say somebody screens positive on this, right? We got all the work that Corrigan's doing, Dr. John Corrigan over in Ohio, right? I mean, brilliant dude, been doing the CDC data for years, just a good guy, tons of opportunities for his graduate students. And we've got good follow-up measures, right? We got follow-up. So somebody screens positive on this, then you get to go do the real history, right? Then you get to ask all the real questions, because what we know, you have one head injury, you're much more likely to have another, right? 8 times more likely, actually. So you start compounding that, and we really start asking these deeper questions. Then we can start really logging your history of brain injury and see this much more complex, complicated concern. And then we continue to address it from a medical perspective. So I really like Ohio State's TBI ID form. We recommend it at all of our trainings, especially if you have a positive primary screen, because then you're going to get this history. And we love that there's a program down in Tucson that's using this with all their folks who are SMI coming out of incarceration. So we're screening before we leave. Novel concept, right? Thank you, Dr. John Corrigan and Shanna May Sleeman.
Specify
right?
we. Like
say what?
Research. Can you specify we when you say that? Like what empowerment research does?
Oh, sure. So this project, actually all I did was inspire the person who was working over in mental health in Tucson. She came to some of our trainings. She's like, oh my gosh, this explains everything about my son. Her name is Shanna May Sleeman. She was like, she had a lot of difficulties with behaviors with her son. And she started coming to our free TBI training. So we basically write contracts and grants, and we get federal and state funding to be able to provide ongoing community education. She came to one of our community events, started coming to multiple events, and she really saw the applicability because she is working in mental health, and she was specifically working with incarcerated populations. And we said, hey, call Dr. Corrigan. He's a totally open dude. He loves working with people. Maybe he could put a project together with you. We don't know, but he's an awesome guy. And boom, they connected. She got the forms, talked to her management, talked to the administration. They were all on board. She started a new program specifically about TBI and incarcerated populations. And now we have universal screening in that setting for people who are leaving with mental health labels, coming back, trying to become reestablished after short-term and long-term incarceration. So when colleagues get together, when we share this free information, when people realize that there's an opportunity to utilize it in their setting, then all of a sudden referrals start becoming appropriate. Right. And we're not referring people to places that are dead ends and box canyons where they're not getting the services they need. And then they get frustrated and then they withdraw and they go back and hide in their hole, and substance abuse goes up and suicidal ideation goes up because we as professionals didn't make the right call, because we weren't trained to know who our real referral sources were. So to me, this is evidence and data that when we get good screening in place, we then have a real triangulated opportunity to say our observations, our screening information, and our assessments are all coming together to validate formal assessment, informal assessment, and now let's take some real action down a path that's going to provide people with real answers. And that's the partnership.
Yeah. And I love that you said down the path, because I don't know why, but I always have this visualization for people that maybe grew up in a rough area and led them somehow down a path toward whatever it was that got them in jail, whether it was like violent behavior or addictions, whatever. You are a boy in a neighborhood with other boys. It's normal to wrestle and ride your bikes. And like, it only takes one fall to damage your brain, but specifically your prefrontal cortex hasn't even started really developing yet when you're young. And that all of a sudden makes you more impulsive, but also learning struggles. Suddenly you can't really focus. Suddenly you can't really read anymore. Maybe you would have been diagnosed with dyslexia if you actually went to the testing, but you be attaching a label to yourself. Something is wrong with me. I'm dumb. That leads you down a whole different path. Friend choices, all of that go along with that. So I don't have the stats in front of me. I'm sure you could just Google Dr. Daniel Amen, traumatic brain injury prison population, and it'll show you how high it is. And then also that overlap with ADHD being misdiagnosed and learning disorders, especially Irlen syndrome, which is really common with concussions, but also common with ADHD and dyslexia. I know, I love your glasses.
Helped greatly.
It's just a completely different way to look at your life story, other than you're bad, you did bad things, you're going in jail, and we're using our tax money to give you really crappy food that's not even going to try and heal you back into society. Exactly. Dr. Jay Faber in our LA location of Amen Clinics wrote a book, and it's specifically geared toward people that are in the prison system and things that they can do throughout the day to kind of improve their brain health, even though they're not being given supplements and the right foods and things like that. Really wonderful. If anyone wants to look at that, you can go online and find it. He's a huge supporter of free education, especially in the prison population. And then one of our doctors in the Atlanta clinic was in the prison system. He actually ran the women's prison in Georgia, and he's knowing what he knows now about hormones said so much of the reason they were there was hormone imbalance, where they basically blacked out or whatever and did really impulsive, horrible things. And they're like, oh my gosh, what did I just do? Next thing you know, you're in jail. You're never going to see your kids again. And we know hormones are strongly influenced by traumatic brain injuries, as well as toxins. And especially for women, I know it's hard. We have makeup, we have lotions, we have hair stuff, we have all this stuff. But if it's poison, you need to really reevaluate what it is. It's just this bigger conversation that I can't express enough and say enough.
Well, and firsthand, I was doing outreach to the prison populations about 4 years ago. We were given the opportunity. I've worked with Native American tribes for many years and have really, really great relationships with the Navajo Nation and Tano, Apache, and White River, and mostly in Arizona, but also across the Southwest, and also some tribes in Canada and Nova Scotia and in Alaska as well. But I went in, I went through the metal detector, walked in, we've got all our training materials, we've got our post-concussive cards, we've got our packets, everything's approved, all the staples are removed. I mean, we did everything by the book. And I walked into this room with 24 gentlemen in orange jumpsuits and one gentleman who was standing by the doorway who was a Department of Corrections officer for the Navajo Nation. And I was there in a partnership with Indian Health Services Primary Prevention. And it was a day that was very enlightening for me because everyone was minimum secured. I mean, we've been in max and medium as well, but this work was specifically with inmates. And we were doing things like brain gym exercises, as well as providing information on brain injury. And the first question I asked is, how many of you have had a loss of consciousness before the age of 15? Because we know John Corrigan's data suggests that those adolescent and pre-adolescent injuries prior to puberty are huge.
Right.
24 out of 24 gentlemen raised their hand.
Wow.
Now, these are all injuries with loss of consciousness. These are all severe, quote unquote, mild TBIs. And the officer standing at the doorway raised his hand, which led me a little bit to be a bit concerned about security, but it's okay. I'm like, oh, great. And so we started talking about the severity. And a third of those individuals had a loss of consciousness over an hour.
That's crazy.
So we started asking, well, how did it happen? What happened? Rodeo related, animal related, fell out of the back of pickup trucks. Couple were DUI, but that was a very small number in comparison to, and I think that tends to be the typical stereotype, right?
Absolutely. And that, again, that guilt and shame
wrong
along with it. Like, oh, you deserve to get a brain injury if you're driving drunk. Like, you could have killed somebody. It's like, well, what if the reason I was drinking and self-medicating was because my prefrontal cortex was damaged when I was 7 and I was ejected at a high speed from a boat because my uncle's an idiot. You know what I mean? Like, it's just like things.
Right.
Think
and
about.
if these injuries are happening early, these kids are out, maybe they're moving sheep around the ranch, or maybe they're going to summer camp with their animals. Maybe they're doing rodeo on the rodeo circuit. They're playing football, playing basketball. These are regular ongoing injuries, but then you add, time of travel, quality of travel, how easy is it to get to a level 1 trauma center? Yeah, I mean, there's a whole lot of concomitant issues that arise. But to me, being there and having conversations about bad decision making as a result of brain injury, you just see these lights go on and nobody's going to cry because you don't want to be vulnerable in that environment. And everybody was either there for DUI or domestic violence, right?
Yeah.
But a guy came up after we were packing up and he said, my cellie, his cellmate, he said, my cellie's been here like 90 days. And the guy doesn't know what day of the week it is. And I said, well, why is he here? He said, oh, we think he's here for DV. And I said, what do you mean you think he's here for DV? Well, he can't remember anything. And he has this, and he points to him and he's got this massive scar from a huge neurosurgery. And the scar is still new, right?
Wow.
So you sit there and you think to yourself, and nobody bothered to ask any questions about why his behavior changed. We missed it. We missed it, right? We missed it. So, that to me was just a real aha day in terms of the prison system. And then my husband's experiences, because he spent 15 years in as a young person. And he said it really shaped him. It really changed him. He said, you live in trauma every day. He said
Exactly.
the
Yeah.
lights are always on, the sleep is lousy. And he said, you start racking that up in your adolescence and your adult years. He says, if you don't think that changes how you think, he says, and then the life threats, the stabbings, the fights. He said, if you didn't have a brain injury before you got there, yeah, definitely got one inside.
Yeah.
So, and boxing is a real common sport inside. So there you go. And then add gang violence, right? Add motorcycle clubs, add all that together. We still daily deal with the impact of those early subsequent injuries. So I see it personally. I see it professionally. I see it as an individual who's a survivor. And all I can say is we can talk about COVID from here to eternity. But what we're dealing with in this conversation has been epidemic for forever. And nobody's reporting our cases on the nightly news. Nobody's raising prevention standards for our issue. We can't even get legislation passed for the PABI Act. And we've asked that for 10 years. So when they start pointing the old cases for brain injury on CNN and Fox and MSNBC, and we start putting those daily counts up, then I'll realize we're talking about serious business here. Because this happens every year, not just
So I have a good closing remark.
good.
So everyone can have their opinions, theories, whatever, but there is a lot of research showing that if you have sufficient, and I'm not talking about great, just even sufficient vitamin D, vitamin C, and zinc levels, you are much less likely to get COVID, or if you get it, you will not really be symptomatic. And if you're wearing your mask and not going out and acting like an idiot, you're not going to get someone sick. Page 100 of Dr. Chapek's book, Concussion Rescue.
Sitting on my kitchen table.
I love it. And I love that it's page 100 because it's easy for me to remember. Has a detailed itinerary of what you would take if you just had a concussion, or if you know after reading the book that you have had one. And what are those 3 things that are in there? Vitamin D, vitamin C, and zinc. Yep. So something to think about for the masses. But yeah,
this has been so fun. I can't believe like 30 minutes
for literally hours because we've done it multiple times. I'm so glad that we got to do a live together though. And I'm really hoping this is going to get more people engaged, and hopefully we'll have some questions, and then maybe we can regroup and talk even more about it.
And folks can come to empowermentresearch.com and come to free training.
Yeah,
get information.
So fun. They're so
love to have you.
Fun, you guys.
Yeah,
I love them.
Thank you.
Thank you so much. You are amazing. I really appreciate you. I hope you have an awesome weekend.
You too, hon.